746, liposuction, something you probably don't want to see on TV. So we're going to show you that. The new procedure, LipoDissolve, has all kinds of new warnings attached to it.
Yes, so now one local plastic surgeon is trying to get nice results without those medical problems. Jen is live in Bala Cynwyd this morning with Dr. Mark Solomon. So I guess we're going to see this performed right now?
Yes, we are. We're actually prepping our patient, TJ, who's actually very relaxed, and his eyes look a little bit puffy right in this area because they've put a lot of numbing stuff in there, a lot of numbing cream and Novocaine, things of that nature. And what we're doing here, it's called LipoLaze. You've heard of liposuction, you've heard of LipoDissolve. This is basically the next generation, and Dr. Mark Solomon has pretty much figured this out. He's the expert on this. And Doc, what are you guys doing right now?
We're just loading up the fiber into the laser.
Okay.
And I'm just getting it ready to put the fiber in while Shram is getting it up in the mask so it doesn't bang into our heads.
Okay. And one of the things that we talked about earlier, you like this because you can dissolve fat in there, and then where does it go? Or you tighten it up?
Well, in this particular use of it, the fat literally gets vaporized. It just melts.
Okay.
And it's not a lot of fat, so there's no place to send it, if you follow what I'm saying.
Well, you guys continue to get ready. I'll show some before and after pictures. The first picture that you're going to be able to take a look at is a chin area where basically they go in with a laser, they zap underneath the skin, and then as you can see in like 4 to 6 weeks, the neck skin is tightened. Same thing he's done in some people in the tummy area where basically someone has a little bit of loose skin or a little bit of excess fat that they want taken care of. And as you can see, in 4 to 6 weeks, that tightens right up. And Doc, one of the things you were saying earlier is that sometimes you use this in conjunction with traditional liposuction, correct?
Correct. And that's a really nice advantage of this because basically it turns liposuction into a more efficient procedure. It melts the fat, making it easier for me to take out, and at the same time, liposuction relies upon the skin's ability to shrink, and using this procedure we can get that shrinkage to a really optimal way. In other words, you have to wait less time to get the skin to shrink with this than you would if you did traditional liposuction.
So we have about 30 seconds, and if you're not ready this time, we're going to come back at 8:45 because we don't want to rush this because this is someone's face. TJ's face, so I don't want to rush you. And are you nervous at all?
Not at all.
You said you're more excited than nervous.
Full confidence in Dr. Solomon.
All right, so here's the deal. You're going to have to wait. You're going to have to call in sick to work. We're going to be up and rolling by 8:45. LipoLaze. Go to our website. We'll link you to Dr. Mark. And again, at 8:45, we're going to get this party started.
I just wondered, does it hurt?
He says it will not hurt. What they did, what you didn't see, is they put a lot of cream on TJ, and then they put like Novocaine, like when you get the doctor, you know, like a dentist's office, into his eyes, and that's why he's all puffy. Bless his heart, he doesn't look this puffy normally. He didn't look this puffy when he came in this morning.
Thanks,
You're welcome, baby. And so basically, then they're going to put the laser in there, so he's not going to feel it. Dr. S told you you won't feel a thing.
Nothing.
All right.
Okay.
So, but we're going to tell you, because we're going to see this thing.
All right. We'll check back with you in a little bit. Thank you, Jen.